Feeling peppy?
Can you hear this? Can you get this? Are you getting this? Is this coming through?
I can. Got it. Okay.
You feeling peppy?
Yeah. Well, in that case, welcome to Strange Coordinates, the show where we use brands as roadmaps to arrive at surprising places. I am Topher Burns.
And I'm Robert Balog, and Topher just dove right in. Wow, this is the 2026 verb that we're getting here.
Yes.
Well, Topher, myself, and our partner Idon lead an advertising agency named Territorial that we started after lifetimes of working with some of the biggest and best loved brands in the world. So what we do at Territorial is we help brands find their place in the world. And we do that by exploring the way in which culture and history and desire and commercialism all bounce off one another to reveal insights about what's cool about being human.
And we take that into this podcast. In every episode, one of us gives the other a brand to explore, and that person has to trek off into the wilderness of the world of brand and come back with a story that they find to be most compelling. It's using brands as compass points to discover more about the world around us.
And you were discovering a very interesting niche of the world around us this time, because I gave you the medical and pharmaceutical brand Lilly,
which is sharp-eared and elephant-memoried listeners will recall. I was like, wait, like Eli Lilly? And you were like, I think it's just Lilly.
But they're related. Are we going to find that out?
They're both. It's both.
Oh.
It's the same company. So this is spoiling nothing in terms of my overall arc of the stuff we're going to talk about. I was like, that was one of the first things I dug into. And apparently they've just like been going to market basically as both since they were created.
I mean, that's pretty cool.
They have like their desire right now at the like corporate comms advertising. Mm-hmm. They position themselves as Lilly. So if they're sponsoring a sports team or something like that, you're going to see Lilly written there. But they are also, because like they've been known as Eli Lilly for a really long time, because Eli Lilly was a person, and we as a culture really love founder brands, you know, but also because apparently like in financial press and in press in general, it's like a little confusing still to like, they'll start because Lilly is like their DBA, but like Eli Lilly and Co is their thing. And in the press, they're going to say like Eli Lilly and Co. And then they shorten it to Eli Lilly rather than just say Lilly, because a lot of times that kind of gets confusing when they're writing it. So they're still being written about as Eli Lilly. So they are both. And there was no point in their history where they were like transitioning away from one or the other. They're just kind of like, potato, Eli Lilly, Lilly, like we're here.
Well, like vibe-wise, there's a huge difference. And like, if I hear Eli in the context of medicine, I'm assuming there's like the thing that they treated the most was like rheumatism, you know, or some kind of 18th century. Like Eli just sounds so old school, whereas
but
Lilly
at the same time, it makes me feel like they're more trusted. You know, like that's like they've been around for a while.
I don't know.
I hear for whatever reason, Lilly, and especially in the way that they've written it, you know, with their little cursive and stuff like that, which is close to kind of like how that not a lot has changed from the branding perspective, and like more than essentially they're founded in I think like 1876, something like that. So like post-Civil War. And we can get into all of this. They haven't changed a lot about that. But for whatever reason, for me, I see how they present themselves to the market right now, and I think like Marie calendars.
Huh. That's so funny, because
like
I think
pie. I think like frozen pot pies.
Yeah. Eli Lilly to me is a guy who addresses everyone as friend. What do you say there, friend? You know,
I like that guy.
I don't think I like that. I don't think I like that. I don't want that person treating me.
I would share a pot pie with that gentleman.
All right. Well, this is the journey we're going to be taking. I'm excited that it's already generated burning controversy.
Exactly.
Brother against brother here. This is the North versus South.
Yes, and funny you should say that, because it's exactly where our story begins.
Oh my God, I love that.
So I have like 4 little nuggets, like 4 things that feel like interesting little lessons about branding that I took away from researching Eli Lilly, or Lilly, as you will. I will
how
probably
many?
say Eli.
How out of the 4, how many rely on me doing something to carry the story?
Oh, did I know you were going to ask this? None.
Okay,
Good.
perfect, great.
You don't have to do any work.
Ah, this is so exciting.
Kick back,
My
and then
God.
just pontificate.
Sure,
Like,
I'm gonna do
go
it.
on this journey with me.
All right,
and,
let's do it.
Just wool gather, and these little lessons are somewhat chronological as well. So we'll kind of track along with the growth of the company as we learn little lessons about branding in general. But we're going to start at the beginning. And our first little lesson, I'm kind of saying that I took away from it, is like science is really branding. So that's chapter 1. Now, Eli Lilly is a person who was a colonel in the Union Army. He was a physician during the Civil War.
A lot of legs and boots. I'm imagining just a lot of legs and boots.
Yeah, I mean, like, when we say like somebody who's like a medic in the Civil War, it just means like he carried a saw, right?
Exactly.
But he was a trained chemist and a pharmacist, and he went back to that world after the Civil War. And one of the things that, as a chemist and a pharmacist, that he was really, really, focused on was that, like, there's a right way to do things. Mm-hmm. And he had seen it in the medical industry before the war, but then during his experience during the war and where the medical industry was in America after the Civil War, he was really responding against that. What was happening in medicine at the time? What do you picture sort of like 1850s to like late 1800s? What do you picture like the world of medicine being?
A lot of ether and laudanum, just knocking people out and going at it, just hacking away.
Yes, but you're even ascribing a level of like professionalism that really didn't exist in this. This is the time of patent salesmen, like snake oil salesmen.
Yeah, right.
This is people traveling from town to town. This is grandma's special tonic. These are things that are a lot of times based with a fair amount of opium, fair amount of alcohol. Mm-hmm. And there's no sort of a predictability batch to batch. So doses are kind of wildly different. Claims
so like proto-Maha, basically. This is Make America Healthy Again 1800s edition.
Well, this is just Make America Healthy. They were just Ma back then.
They're Ma.
They were doing the good work right at the beginning. And we're trying to get back to that time now.
Perfect.
So medicine was like, there was a fair amount of quackery, and also if you're a doctor, it was kind of challenging because you didn't know what to prescribe your patients.
Right.
Like, you were kind of like, I know that this person has this problem. I can't get my hands on a reliable dosage that means that like I know this person's gonna, unless it's something that I do myself, right, or it's something that is like super, super basic. So folk medicine is kind of a thing, and then you had these just like basic chemicals. So you're just using ether. You're just using the basics of the basics, right, because those are the things you can rely on. So Eli Lilly really introduces a different way of doing things. I'm going to create medicine that is standardized, that for the first time he is listing the ingredients on all of his labels. And that was huge. Nobody else was doing that at the time because it was kind of your own secret. The whole thing was like, it's my secret sauce. This is how,
right.
And so he's like, no, I'm going to put all of the ingredients right on the package. You're going to know how much is in them. I'm going to say what these things are for, and I'm going to standardize so that I'm going to create something that it can be relied on time and time again. The dosage is the dosage, right, and becomes kind of the doctor's best friend because he's creating stuff that can actually be used as medicine, that can be standardized, it's predictable.
So Eli was the one, the kind of a trendsetter in this regard. Was this happening widespread, or was he really?
No, this is really. He was the first to market, and in fact, he had created. So he returned home to Indianapolis, and it was the first. He actually had like multiple different partners that he worked with until he was like, nah, I got to do it myself. I got to do it the right way. Mm-hmm. So he was a real stickler for like rigor and exactitude. That said, so this is kind of like his claim to fame. This is why he's like so, known. I should say before I give you a that said, like he's inventing stuff that's like really super interesting. Like Eli Lilly invented the gelatin capsule to put stuff in, because before that, how are you gonna, like, people don't have like a super sensitive thing, like you're measuring
scale or whatever,
amounts of powders, like that's difficult to measure, and it's also difficult to then administer, especially if something tastes bad. So gelatin capsule is an Eli Lilly invention. He also started putting sugar coating on tablets to make them easier for people to take, and adding flavors to medicines as a way for people to, take them down. Now, certainly, like, people were kind of, mixing their patent medicines with other stuff to make it go down. But he's kind of like making it so that it's like, you don't have to take the guesswork out of it. It's pretty easy to take.
All right. So my love of Dimetap as a child is probably directly related to...
It was so funny. So Jake and I are doing Dry January.
Same.
And so we're like buying some like NA Amaros, like just like, a little digestif. You want a little treat at the end of the day, but you don't want to like open up the door. And so he brought home one yesterday that had been like bombarding him on Instagram. And I like had a little bit and was like, nope, that's Robitussin.
Oh, yeah.
I hate that. You like
Dimetap. Dimetap.
Oh. Was Dimetap good?
Yeah, it was like grape flavored. It was really... It was like the weakest of the medicines. Like Robitussin was real medicine. Dimetap was basically like, I don't know, maybe it did a little bit of like, oh, my sniffles aren't as bad, but it was just so delicious. It was like grape juice.
We never had Dimetap. We only had the Tussin, and that was
the Tussin was the worst.
It was so rough.
Yeah.
So Eli Lilly at this time, he's in a world that is like, he's making a name for himself by being like scientific.
Yeah.
But the reason that my takeaway of this first thing is that science is a brand and not a thing is because he's bringing this amount of like rectitude and predictability to an industry that is still wildly unfounded in like real science. So his best-selling product, the like banner thing that he came out with first, was this tonic called Succus Alterans, which I believe is Latin for alterating juice. It is known as a blood purifier. Patented
I'm not comfortable with those two words next to each other.
No, I mean, like,
no.
It's like, it sounds very dialysis.
Yeah, it sounds very sort of like nasty shit in the middle of the 20th century. Like, I'm not here for it.
It was, sure, totally that. Patented in 1888. The Library of Congress still has their trademark, and they're on the bottle. It has all their ingredients in it, and it says a specific in the treatment of syphilis, blood and skin diseases, chronic eczema, catarrh, and rheumatism, taken by infants and adults any length of time without injury.
Amazing. Probably bullshit. What is it actually made out
of? There was like a bunch of herbs, and like there's nothing to indicate that this is like in any way scientifically backed. and the problem itself is also suspect. Like what blood needs to be purified besides, as you say, some gnarly stuff that went down in Europe. So yeah, I think that like they had some stuff that was like really well, today is still like, you kind of need those types of things, or like, you can use Cape aloe to cure constipation. But there's other stuff that's a little more like, that's just like a very rigorous, very exact version of a thing that is still not terribly scientifically backed, because they kind of came in and were like, let me do patent medicine, but the best you could do patent medicine. So to me, that's why the lesson for this, like early time in their lives, is like, science really didn't mean like actually, like rigorously backed with the type of evidence that we would call it now. But we still recognize how they go to market and how they talk about themselves as being scientific. And so to me, there's like a takeaway between like how you act scientific from a branding perspective versus like how you act scientific from like a testing perspective. The latter will continue to change, I would say, more than the former will. I think what feels sciencey from like a brand perspective, I would say if we go 100 years into the future, we'll still feel we're research backed, we're, you know, like very exact, we're not joking around, we're very clean. We're upstanding people, we give you all the information up front. I think that'll always be the hallmarks of like a science brand. But the way in which you deliver against that will probably be very different in 100 years than it was, 100 years ago.
And it's also like we were mentioning Maha before, but it's also the fact that we are still having debates around what constitutes science, what it means, tells you that it is a subjective thing as opposed to an objective thing. And so that definitely qualifies for a brand-like object as opposed to something that is immutable and like, forever.
Yeah, absolutely. Cool. Okay, so that is our first little nugget, our first little takeaway that Eli Lilly has to show us about branding.
Yeah.
Number two, I call big pharma energy.
Ooh.
So this kind of takeaway is, we go a few years further forward in history. We're talking around the 1920s. What happens between the 1880s and the 1920s is that Eli Lilly as a company continues to grow. It stays in the family for a really, really long time. So his son and then his son's son, et cetera, et cetera, et cetera. He's still in the picture at this point in the 1920s. But the company itself has earned a reputation for being reliable, a lot of times through doctors as kind of like a vector that's like, this is a thing I can rely on. So they continue to create new products, new systems, new ways of administering medicine, really helping the medical field in general advance in terms of its ability to treat diseases. So before 1920s, I'm going to talk about one specific disease that Eli Lilly had a huge impact on.
We've never talked about a disease on this podcast, which this is exciting.
Okay. Yeah,
Here we go.
Robert loves diseases.
I'm just saying it's a new thing.
Yeah.
We've had political strife. We've had, all types of social
of the
wars.
4 horsemen. We haven't brought pestilence in yet.
We have not brought pestilence, you're right.
Fair enough. Okay, well, it's her time to step to the front.
Go, girl.
So, before 1920s, type 1 diabetes was a death sentence. And it was particularly tragic because unlike type 2, which is adult onset diabetes, type 1 happens really early in a child's life. And basically, the kid just wastes away. The only treatment that they could really find was a starvation diet. And that didn't really help because the kids still needed to eat. So then every time they ate, they were starting to have problems. And it was really unusual for kids to live very long. They would die in their teenage years, if not earlier, from type 1 diabetes. And it was prevalent enough that it was really this world recognized tragedy.
Right.
So what happens in the early 1920s is that an inventor at the University of Toronto discovers the role of insulin, first in dogs, then is able to take some of it, purifies that with the help of another researcher at the University of Toronto. They administer it to a 14-year-old boy, and he gets miraculously better and stops wasting away and is able to eat, is able to gain health. And it's this massive, earth-shattering discovery because it was long thought that this is just kind of some kids just get this wasting disease and then they disappear.
Yeah.
So the problem was these inventors and the University of Toronto did not have access to the type of pharmacological research apparatus and scale and distribution that they would need in order to tackle this worldwide problem. This isn't in specific places. This is just happening to kids all over the world. And so their ambition was, okay, this can really be a game changer for humanity. How are we going to get this out into the world? We need to find a partner who can help us do it. Eli Lilly was pretty much the only game in town. There were some other, companies at this point, but Eli Lilly had this sterling reputation and the trust of doctors and these laboratories, these research scientists that could help them. So what Eli did is two things. One, they figured out how to kind of refine and mass produce this thing and then distribute it.
Right.
And that was super, super important because everybody wanted this. There's a clamoring of this worldwide. Right. And another thing that enabled this to happen that's going to later come back, spoiler alert, in chapter 3, is that the inventors of the of insulin, who, by the way, get a Nobel Prize.
As well they should.
They sell their patent. They each sell their patent to the University of Toronto for $1. And their quote is, the insulin belongs to humanity. Like this isn't a thing that we're not here to profit from this. We are here to make the world better. And so what that means for Eli Lilly is that they don't have this massive copyright that they have to buy against. There's not a trademark that's going to be an impediment to them. So the university comes to them. They haven't had to pay an enormous amount out of pocket, and they're just able to kind of say Eli, get this shit to the public as soon as possible.
Yeah.
So that really puts the framework together for things that we are starting to recognize as big pharma, because you're having these different components of the system of developing drugs all kind of coming together. So you have the invention component, you have the with individual inventors rather. Then you have this research institutional component with the University of Toronto, and then you have kind of the scale component with a drug company. And so it's kind of the first time where you're starting to see all these different actors be stitched together into a system. And the point is deploy this as quickly as possible, as widely as possible.
Was the federal government involved at this point? Or
No.
It's all private market? Okay.
And I mean, you could sort of say, because it's the University of Toronto, I'm sure they're receiving Canadian state funds, so there is there is a governmental connection to it. And certainly this type of partnership model is still something we see today. It's not the only way drugs go to market now, of course. A lot of big pharmaceutical companies now do all of that stuff in-house and own all of the pieces of that process. But, when we think of things like drug prices or, a lot of it is kind of it's difficult to bring drugs to market. It's difficult to put all these things together and get them out. And then, copyrights elapse. And so it's important for us, or trademarks, should elapse. And so it's important for us to be able to recoup money to be able to continue to make stuff.
Yeah. Okay, so big farm energy. We're laying the groundwork for
Eli,
a particular 21st century model.
Yeah, and Eli Lilly kind of being there right on the ground floor of spinning up what it looks like to move from drugs that are maybe complaint specific or smaller level types things, you're sick, this will help you make you feel better, to we take people who were going to die, and because of this drug you don't die anymore. And we're going to do that for the world. And so
that scale is incredible in a half century.
So they really moved, like you said, from something that was at a smaller level into something that feels much bigger.
Yeah, and it's interesting too, because as you mentioned, that also mirrored the growth of medicine as a field. Yeah. And I mean, if we think about advances, times of great advance, if you think about the turn of the century, of the 19th to the 20th century, massive shifts in everything scientific, from psychology to physics to chemistry, and even to biology and anatomy, as we're learning now too.
Yeah, absolutely. And it also isn't just a shift in our technological capabilities, but it's also a shift in our cultural expectations around what sickness and like mean, right? Because we've moved from like, sometimes you get born with a thing that's going to kill you, and like, into we can treat these things, we can figure out how to stop all these things, like
Yeah, I mean,
and that's not the only thing that in that period you're talking about we start to figure out how to save people's lives.
yeah, and also like if you think about the two examples that you gave in chapter 1, it's the succus auribus or whatever it's called,
Syphilis.
which was about a loose conglomeration
Right.
of potentially blood-related
Yes.
ailments
Yeah.
to retreat a very specific condition that is related to insulin, and like it's very, very precise. Like that journey is also incredible in such a short period of time.
Yes, absolutely. So that journey takes us to chapter 3. And we're going to jump well ahead at this point. Because what we've done is we've kind of like laid the groundwork for this acceleration of this model. We're thinking of science differently. We're thinking of like the way that money is connected to this stuff differently. We're going to go all the way to 2022.
Oh, okay.
And in this chapter, I've loosely named it, for lack of a better zingy term, it's complicated to save lives for money.
Okay. Yeah.
It's a sentiment. It's maybe not, like a tagline for
I
a
feel like
commercial.
you would, if this chapter became a Broadway play, the title would be "It's Complicated" and then be a long
To
parenthetical.
save lives
underneath
for
it.
money.
Yeah, exactly.
100%. So in late 2022, I believe late November 2022, a tweet goes out.
Okay.
And the tweet comes from an account that says at Eli Lilly and Company. We are excited to announce that insulin is free now.
Right, I remember that.
And there are a number of things that are happening at this juncture.
Yeah.
We've obviously been through some wild shit as a culture.
Not familiar. Not familiar.
Over the past 2 years at this point, we are hyper aware of companies and their capacity to make life-changing medical advances.
Yeah.
We are also hyper aware of their desire and capacity to make money from those. What's happening in the digital world is that Twitter, the beginning of November, was like, what would be cool if hey, remember those blue check marks that like you had to earn?
Right.
Let's make people buy them. So a writer who I think just had kind of like a prank the world and let's like reveal sort of like some of the inherent truths, like an onion type, person. A writer he repurposes a existing Twitter account of his own. He labels it Eli Lilly and Co. He buys the blue check mark. He puts the Lilly logo right next to it. And then he clearly marks in the bio that this is a parody account.
Right.
But who reads bio
Nobody.
in the days of Twitter? And so he just posts, we are excited to announce that insulin is free now. And that tweet goes bananas. Like it goes viral immediately. And in this world of it going viral, not only does that mean that like everybody's like, first, oh my God, that's so amazing. And then the crash is like, wait, oh, okay, it's not free. And then everybody piles on and is like, and here's why that's a problem.
Yeah, exactly.
So the whole, what it creates is this like, wait, why is this an issue? I have to say that at the time the tweet went out, I wasn't that connected to like, what does this mean? But we've now been 100, almost to the date, 100 years of insulin existing and being mass produced.
Yeah.
And so when this tweet goes out, in the beginning, we started with like the inventors of insulin literally selling the invention for $1 so that the world can have it. But by the time that this tweet happens, what you have is a situation where people in the US pay 10 times more for their insulin than other wealthy countries.
Right.
You have 25% of all insulin users in the US rationing their use because of price. And also, that means that those people who have, if you have type 1 or type 2 diabetes, you become a slave to your insurance because the costs are now so preventative that if you are off insurance, you are paying what can be financially crippling amounts of money per month in order to stay alive.
Yeah.
And so the debate flares. Bernie Sanders uses this as an opportunity to talk about drug prices.
Sure.
Like, this becomes a thing that everybody talks about. And Eli Lilly at this point is one of the largest, most successful, most financed, and like heavily scaled pharma companies in the world. Their stock loses 6% of its value overnight because of this tweet. Novo and Sanofi, who are, as far as like global producers, also they're like a, I don't want to use the term, but a cabal basically. These are like a what's the term
I
for
don't
the
want to
drug?
use the term, but here's the term.
Well, give me what's the term for the drug?
Cartel.
Yeah, let's call them a cartel instead of a cabal.
Yeah, that's better.
Yeah.
That's definitely
A little
better
less
than the
tinged
cabal.
with our mid-century problems we were talking about, our European mid-century. Yeah, so they form truly a drug cartel, or these are the only producers worldwide of this substance that you can basically buy it from.
Yeah,
and so their stocks fall as well. So it's estimated, it's difficult to estimate because since then, obviously, all of these companies have their stock has regained its value. It's been 3 years since then, but it's estimated that this tweet sort of like evaporated $15 billion worth of value.
Wow. Yeah. I mean, it's interesting too, because like, as soon as you said it's been 100 years since the invention I guess invention you'd call it, the discovery of the power of insulin, I immediately thought of the public domain rule, like how in entertainment and in copyright, there is an expiration at 100 years where a thing that was created that was copyrighted, in 100 years it becomes public domain. Like, what if we introduce that for medicines? Like, why are we beholden to? And in many ways, that might actually be happening because you have generics that are being produced. But it's interesting that somebody can create a stranglehold on a thing that is so valuable to so many people.
Yeah. I can't say for sure, because I don't know this component of it. But yes, you can make generics, right? Like within any drug patent, you have the capability of like anybody can make generics after a certain amount of time.
Yeah.
What I think is the deal with insulin is it's just kind of about like straight up supply chain, straight up distribution. You know what I mean? Like,
right.
And so I don't know if there's like, like a Warby Parker of insulin. Like we cut out the middleman. We're sending it directly to you. Like that would be great.
That must be, right?
Yeah. And I think that's kind of what would potentially be needed in this specific instance in order to be able to like make it easier for people. Because I don't think it's that like no one else can,
Right.
I think it's that like no one else does because there's just a significant amount of advantage to the incumbent players in this space.
Yeah. Yeah. I mean, so it's really, you raise an interesting point that there was this kind of like, this bubbling under the surface, I think, which is really the story of the early part of the 21st century, that these issues are bubbling under the surface and a flashpoint makes them erupt. And erupt in a really huge way and sort of starts to shift conversation. I think the big question is, do we have the ability to sustain any of these moments of indignation into something that's actual real change,
Yeah. Well, I don't have an answer for you in chapter 4. I'll tell you that much.
All right. Okay.
I don't have an answer for that. I'm just saying, like, if people are waiting for me to resolve that, I think it's a great question.
That's what they turn to this podcast for,
Yeah.
Tupper, is the solution to
you.
intractable social
We got
problems.
the whole thing ironed out in the next 10 minutes.
Yeah.
It's interesting because for Eli Lilly, this it's a little glib to be like, it's complicated to save lives for money, but also like it really, I think that's one of the things I took away from this specific thing is like, yes, like, should we want to see this cartel's power on, people's lives diminished? Sure. But that's so much more complicated than saying like, Eli Lilly, give up the, help other people be part of this. Because that's really kind of only like a small part of this picture. There's the doctors who prescribe. There's the hospital systems that are involved in the supplies that they get. There are the insurance companies and what they're willing to pay for each one of these things. And so, like, there's this, like, tripartite, intractable system that's locked around this stuff that is creating a scenario where Eli Lilly does raise the, like, sticker price of insulin because that's one of the ways that they've been doing this like insane gamesmanship with the insurance companies for decades. And so like every time one does the other, so like we see these crazy inflated prices and the prices aren't inflated in single payer places because they were like, well, let's find a fair price so that people can continue to get good quality care. And we have not created that system because we think the market, the seeing unerring hands of the private market will take care of all of it.
Well, I was thinking about that while you were talking because, in chapter 1, you were describing a time almost prior to market forces shaping medicine and science. It was sort of individuals on a one-to-one basis kind of like trying to convince somebody else that what they had was effective, and there was not sort of like wide-scale competition. And in many ways, your first point about science as a brand, somebody like an Eli Lilly subjected science and medicine to the market forces by doing the things that brands do, which is sort of like defining your differentiators, standing by like a thing that that sort of unifies your products. Like that all of a sudden kind of invited market forces into this realm and changed the dynamics in many ways, or at least reflected a changing in dynamics to medicine.
Yeah, absolutely. And that's going to kind of continue in some interesting ways when we get into chapter 4, actually.
Ooh, chapter 4, let's do it.
So chapter 4, I'm going to say, we'll call it banking on culture.
Okay.
But you could also potentially call it maybe like the culture of science. We're now kind of up to the present day. And this is not, I hope putting you too much on the spot, but when you talk about like what's happening in medicine and science, what's the like number one thing?
I mean, GLP-1s,
absolutely.
Right? They're everywhere.
Absolutely. Yeah. So Eli Lilly has some offerings to bring to the table. You may have heard of Mounjaro or Zepbound. They were not the first in this space. So Novo Nordisk got, obviously earned a name for themselves as kind of being the first ones to go to market here. What I found fascinating about this moment, GLP-1s, is that if you look at it, insulin, the thing that took Eli Lilly to the top more than 100 years ago, and GLP-1s are the same fucking system.
Yeah.
So
totally.
I had to dig into this because another thing that was like a little embarrassing is I was like, wait, I know that insulin is the thing diabetics need, but like, why? What?
Yeah.
What?
Yeah.
You know what I mean?
I'm so excited you're taking us here because
I didn't have a clue.
Yeah, completely.
So, and what the insulin does is the insulin's job is to take the blood sugar, glucose that's in your blood, and get it into the cells. And so when you don't have insulin, your cells starve while your blood sugar skyrockets. More and more sugar goes into your body, but it's not being sent to your cells to use.
Right.
And so that's why you have things like organ failure if you have a diabetic that doesn't have the insulin levels that they need. Because insulin is there to basically like push all that stuff. Like, okay, cool, we've got it. Let's pull it in here. What GLP-1s do is that they actually look at that system, which is kind of like the metabolic system in general, and they sit outside of it and they help police it further. So insulin is one of the things that GLP-1 kind of interacts with in terms of regulating overall feeling of satiety or a feeling of being satiated, like you've had enough. And so insulin plays a key role in GLP-1s helping you to feed, your body still needs to feed itself an appropriate amount, but you also need to know when you've like had enough. And so these two things, it's not like, you know, they made insulin and now GLP-1 is just like specifically like replacing insulin, but it's the same thing in the human body, which is like the absorption and regulation of nutrients that we need to survive.
And it's wild, like 100 years later.
Yeah. You know. And what I think is so fascinating too is that we're talking about the same system, and we're talking about disruptions in that system, which are basically like you can have it go either way. You're not getting enough nutrients, or you're just like taking in too much. Both of those are just like two different ways that you could say like this system is interacting, but culturally they're viewed so differently. Eli Lilly, 100 years ago, Nobel Prize winner, you know, winning scientists are interacting with them, and they're like, you know, on the cover of magazines saving the world. They're saving children. And then today, there's a lot more cultural conversation around whether GLP-1s even count as a drug. Do they count as medicine? If what we're doing is, you know, like, and from a lot of people, they view the GLP-1 world as a world of kind of like plastic surgery. You know, it's like, this is optional. Like, you couldn't take care of yourself.
Yeah, it's like elective.
Yeah.
It's elective medicine.
Yes. And like, that's certainly not the case for everybody.
Totally.
But that is kind of the label that's being put into that. And so it's really interesting that Eli Lilly is now in this opposite side, where they're like, it isn't just easy for us to waltz in and be the saviors. But what's fascinating is, I would say, based on like analysis of how other GLP-1s have been taken to market versus how Eli Lilly is taking their GLP-1s to market, Eli Lilly is taking a very culturally nuanced approach toward how they deploy Mounjaro and Zepbound. They're focusing a lot more on things like removing stigmas, showing the personal perspectives behind why you would want to use this. They're also focusing a lot on access, and that's both at the cost perspective in terms of very aggressively pricing their drugs down to make it easier for people to get. But they're also looking at like turning them into pills instead of injectables, so that they're things that people can take much more easily. So the format is easier. Now, is this them being like, we just want to help as many people as possible? Or is this them being like, we want to move as much of this shit as possible? Like, both things can be true. You know what I mean? But they are showing an enormous amount of cultural sensitivity towards how their products are being deployed. And I think you don't get today's deployment and go to market of Mounjaro and Zepbound without having chapters 1, 2, and 3 in your company's history to enable you to understand kind of like how to talk to individual people in the language that they want to hear it from chapter 1, which is like, I know that people want to hear like this snake oil stuff. They're at the level of blood purifier, so I'm going to meet them there. 2, understanding how being science forward and focusing on the impact for society is a thing that you need to like fully understand in order to be able to successfully go to market. And then 3, knowing how that can blow up in your face if you aren't super sensitive to the like full nuanced world of that.
Yeah, completely. Yeah, I mean, like they definitely behave like a very mature, very wizened brand.
Yes. I totally agree. I think that's a great way to phrase it. And like I hadn't gotten there. So I appreciate you saying that. Like, because I think when you go and you like look at how they talk about themselves, and also how they like put things into market, the way that I agree that it feels like it feels like a company that has learned from its history, which is not what
Yeah.
we can say about every company that we've talked on this podcast, even, you know?
For sure, Chiquita. I'm looking at you, girl.
Yeah.
It's interesting you landed here because without knowing it, I think that's what was attractive to me about this brand. The thing that really I was like, I just kept on noticing is that after every single Zepbound or Mounjaro commercial or any of the other sub brands, they end with the Lilly red screen, the beautiful Lilly script, and their tag is a medicine company. And something about a medicine company as your brand tag just has hit me so. I was like, God, that is good. It's like, it is so clear, so definitive, so confident, but also kind of approachable in some weird way.
Yeah.
And I think like this is that type of, it's not swagger, it's stature.
Yeah.
This is that type of stature that we're talking about here. A brand that's kind of learned the lessons of a century plus of doing business in a pretty cutthroat category where the stakes are as high as they can possibly be. You know what I mean? Like their mistakes, their mishaps are life and death. And so like, I don't know, there's just something about the way in which they carried themselves. And I think that their rebrand was a thing that really stuck out to me. I just really love how they like, adhered to their history. As you mentioned, the Lilly script right now is connected to what they've always been, but it has just such a modern sensibility, and you're really kind of filling in that story. You're sort of explaining what I was kind of intuiting from them.
I love when that lines up where you're like, oh, I was, it's nice when the thing you sense from a brand speaks to many layers that back that up. And it's, again, like can't be said to be true for all brands. And in fact, many times the whole purpose of branding is to say something different than like what,
Right, yeah.
But when it's done well, I think what you talked about is absolutely, what you want to see, where you're dealing with a company that has engaged in with integrity, but also probably with a shrewd amount of business acumen, in a very complicated space that we all absolutely rely on to be here. And to be the age we are, and to have the life expectancy we do. And then to be able to kind of like still engage and communicate with us in a way that honors that and puts them on a front foot, I think is really interesting.
Yeah. When you were kind of looking into sort of chapter 3, do you have a sense of when we shifted culturally from thinking about medicine to thinking about pharmaceuticals? Like, did you come across that at all? Like, if I think about maybe because I was a child, but the notion of a pharmaceutical company or pharmaceuticals or that model that we understand feels relatively new to me. From like, if you think about like the Bayers of the world or like, I guess Lilly, which I would have always thought of as more of kind of like a medicine focus. Is there some like, was there a tipping point where the idea of like a pharma or big pharma energy or like the way the pharma model sort of came to the fore?
That didn't pop up, but let me give you the two. In my research, I don't have a bunch of stuff in that, but let me give you two things that occurred to me while you were talking about that.
Okay, cool.
One is I can remember when pharmaceutical, that sort of thing. Like if you think about that in the context of like the 1950s, like that's a very trusted and friendly thing. You would associate pharmaceuticals with also like getting a root beer float. Like it was not only a place that you could trust that you're getting good quality stuff that was going to make you better, but they also there was fashion. People were getting clothes at drugstores, and you were going there to hang out. Like it was like it was like the Barnes and Noble of the 1950s. Like this is like kind of the privatized town square where people are going to hang out and see each other. And so there was like it was almost like not just like an authority but it was also kind of like a friendliness. But then I think that like the last gasp of that word sounding okay was the opioid trials, the Sackler family. Like, I think that, like, to me, there's a difference between pharmaceutical, to me, is like company extracting money from big groups of people that may or may not be able to afford the money that they're paying out, and they are keeping secrets, and there are all kinds of other special interests that are in the mix and getting fed before I'm, getting whatever I'm getting. And my doctor might not even have all the information. Like it is murky and scary. I think by the time you get to kind of like opioid epidemic.
Well, it just probably explains that tagline, why they landed back in this space of like, we're not a pharmaceutical company, we're a medicine company, which is a really smart reframing.
Totally agree.
A look backwards at medicine is smaller scale. It's 1-to-1. It's a thing that you get from your mother or your doctor.
Totally.
Your caregiver. It is not produced in some faraway factory.
Yeah.
And I think it's a really savvy reframing for them.
Agreed. It's really connected to, like, it makes you better.
Yeah, totally.
It's so fast.
I mean, exactly. Well, that's amazing. First of all, thank you for breaking it up into chapters, because I love a hero's journey.
Chapter 3 wasn't necessarily the title wasn't as flashy, but that was the best I could come up with. So I appreciate that you gave it a Broadway show moment, because then that did feel like it was a little bit more valid.
Yeah, absolutely. Well, I didn't think that, one, we'd be talking about syphilis and diabetes. I also want to just flag that basically what you were saying was that Eli Whitney was the Elizabeth Holmes of his generation.
With the blood purifying?
With the blood purifier, yeah.
What if he had a really, like, it would be amazing if I went back and I was like, turtleneck.
Yeah. And just
it's turtlenecks for years.
And just like a really strangely deep voice, like,
my name is Eli.
How you doing, friend?
Yeah. I was a colonel in the Civil War.
That leg looks kind of gangrenous. So anyways, amazing journey. I'm excited. You've raised the bar yet again, Topher. So now it is the time to reveal. It is time to give me my medicine and tell me who we are going to be talking about next time.
Well, hold your nose. And no, this is one that hopefully you will relish as sweetly as you relish the piquant fruit flavors of Dimetapp. Because the brand that you are going to be pursuing is Blackberry.
Ooh, wow. Have we done a totally defunct brand before?
Well, what do you mean by defunct?
Are they defunct?
You mean like, can you buy a thing with this on it?
Yeah, is Blackberry still
You'll have to tell me.
Brand?
You'll have to tell me.
That's cool. Man, I kind of miss that chonky boy keyboard.
There's a lot going on in this world, and I don't want to like prescribe to you, but I feel like
Blackberry. Wow.
There's a specific sweet spot of like tech that's not too old, but it's old, and I think there's a vibe.
I remember when I got a Blackberry at Ogilvy when I was like. It wasn't right when I started. It was, I think, when I was promoted to creative director, but it was still, like 2007 or 8 or whatever. Like, and I had my, my early iPhone and my Blackberry, and I was like, I am living at like the utter nexus of consumer technology right now. I have both the Alpha and the Omega in my hands right now. And that thing was so big. But, like, easy as hell to type on. You just type, for days on that.
Yeah, like, you didn't have to look at it.
No.
I loved that, like, I could type on a thing where, like, there was enough, not even haptic feedback, but, like, sensory feedback that I could type flawlessly without looking down at the thing.
Yeah.
That doesn't exist anymore. I'm hopeless on this, like, flat typing screen.
Yeah.
Right now, my bugbear is like, I go to type an M, and instead I type a delete. Or I type a period. And so, like, anytime there's an M, it just, like, moves me back. It just, like, it's a mess.
Yeah. Yeah. Okay, awesome. BlackBerry, that's amazing. Well, for that, you should set a reminder in your calendar to join us next time. You've been listening to Strange Coordinates. This is the show where we use brands as roadmaps to arrive at surprising places. Your hosts are Topher Burns and me, Robert Baylog. We would encourage you, if you are so inclined, to learn more about our agency at our website, which is weareterritorial.com. Definitely join the mailing list when you're there. We have a fun little, not too heavy circulation that we put out. If you are on our mailing list, you would have seen our holiday card, which was a lot of fun.
Territorial wrapped, as it were.
Yeah, it was really great. And then also definitely follow us on LinkedIn, because that's where we throw a bunch of stuff as well. So thanks so much, everyone. Really excited. And we'll talk to you soon and see you next time.
Thanks, everybody.
All righty.
I'm really disappointed I didn't hit you with the turn and cough reference, but you said...
What's the turn and cough reference?
I just should have made some sort of all right, Robert, well, turn and cough, because we're going to get
give me my medicine?
Yeah.
I don't even do that anymore. Have you noticed that?
I have noticed that, and I'm deeply
disappointed. The hernia exam is totally
different.
You don't want
to, I'm not good enough for you anymore, doctor?
Right.
You're not into this?